Herzlich willkommen zurück aus der Pause und zuerst einmal muss ich Ihnen ein großes Dank aussprechen für Ihre wirklich lebhafte Teilnahme bei uns im Chat und auch die vielen Fragen, die von Ihnen gestellt werden. Wir probieren natürlich so viel wie möglich dann in der Diskussion wirklich weiterzugeben. Es geht natürlich nicht alles, aber wir geben uns da größte Mühe, dass das funktioniert. Und auch ein kleiner Überblick, momentan sind es knapp 120 aktive Teilnehmer, die hier zusehen und die sich auch aktiv dann natürlich im Chat und bei den Umfragen beteiligen und über die letzten 2 Tage hin sind es ungefähr 1800 aktive Teilnehmer. Das ist natürlich ein tolles Ergebnis für die Konferenz. So, und jetzt starten wir direkt in den letzten Abschnitt der Online-Konferenz und da haben wir natürlich auch wieder eine kleine Umfrage vorbereitet, welche lautet: Was glauben Sie, wie ältere Menschen ihre Interessen einbringen? Und da haben wir verschiedene Antwortmöglichkeiten über soziale Medien, über Rathausdebatten, über Leserbriefe oder durch die direkte Kommunikation mit den Entscheidungsträgern. Und ich schaue mich mal um, bin gespannt, was wir haben. Direkte Kommunikation ist ganz weit oben. Soziale Medien waren eben noch auf Position 2, sind jetzt runtergerutscht auf 3. Und sobald ich es sage, hüpft es natürlich wieder nach oben an die zweite Stelle. Lassen wir einfach mal ganz kurz ein paar Sekunden die Umfrage noch laufen. Schauen mal, was sich entwickelt. Aber direkte Kommunikation zeigt sich jetzt, sind wir ungefähr bei der Hälfte. Und ja, genau, es ist wirklich genauso, wenn ich sage, dann springt es natürlich direkt wieder rum. Deswegen, vielleicht lässt sich erstmal sagen, okay, Leserbriefe sind wahrscheinlich relativ weit unten und soziale Medien, die werden wahrscheinlich... Aber am besten sage ich jetzt einfach mal 10 Sekunden gar nichts, weil immer das, was ich sage, springt direkt nach oben. Also, direkte Kommunikation wird wahrscheinlich die Top-Antwort hier bleiben. Und damit gebe ich erstmal rüber. Schauen wir mal, wie sich es weiterentwickelt.
Martin, ich gebe direkt zurück zu dir, weil ich eine Nachfrage habe. Du sprachst eben von den Teilnehmern, die wir gerade haben.
Ja.
Es sind aber aktuell über 500, richtig?
Über 500 sind momentan aktiv dabei. Das sind über 520 sind es ungefähr.
Da war dir ein Versprecher unterlaufen. Wir fielen auf einmal auf 100 Teilnehmerinnen und Teilnehmer. Das musste ich doch mal eben
korrigieren. Nein, auf keinen Fall. Wir sind wirklich gerade bei über 520. Das war ein Versprecher von meiner Seite. Also hier passiert einiges. Bleiben Sie weiter aktiv im Chat und wir freuen uns auf Ihre Fragen.
Herzlichen Dank. Ja, und das bringt mich auch gleich zu unserer ersten Diskutantin für die nächste Diskussionsrunde. Wir schalten live nach Polen zu Chabiera. Jawohl, sie ist da, zwar mit Ton und Bild, ganz hervorragend. Herzlich willkommen, Frau Chabiera. Sie arbeitet im Büro des Menschenrechtskommissars in Polen und kümmert sich dort um die Belange älterer Menschen, stößt viele Forschungsprojekte an, zum Beispiel zum Thema Diskriminierung, und schaut also immer sehr genau auf die Dinge, die gut laufen und auch die vielleicht nicht so gut laufen. Und für uns wird sie uns jetzt erläutern, wie es um die Teilhabe älterer Menschen steht, welche Daten es da gibt und was wichtige nächste Schritte wären. Wir freuen uns sehr, dass Sie bei uns sind. Herzlich willkommen, Frau Chabiera.
Thank you so much. Thank you so much to the organizers for inviting me to this very interesting and important event. I really would like to congratulate you on that. And thank you to the moderator for your kind introduction. As we've heard so far, there are many aspects of participation of older persons, digitalization and COVID. While talking about some of those aspects, I need to underline that national human rights institutions where I work focus on the rights and monitor whether the rights-based approach is implemented in practice. So that is the frame I'm going to use today. I also need to stress, similarly as Claudia Mahler did before, that we lack an international binding instrument on the rights of older persons, which could be a point of reference in creating national standards in this area. Such an instrument, even by constituting minimal standards, would significantly improve the understanding of the rights-based approach towards older persons. My colleagues often observe during so-called regional visits of the Commission of Human Rights that on local level and in care facilities, older persons are treated in a paternalistic way. Among others, that means no consultation and limited access to information about public services. Without them, older persons cannot fully participate and decide on their lives. The challenge now is less about how to present accessible information online, which is now slowly happening in Poland thanks to the Convention of the Rights of Persons with Disabilities, and of course thanks to various actions on European level, but to effectively reach out to other persons who do not use internet. As we know from Polish national statistics, in 2019, over 60% of persons at age 65 and more never used internet. And the trainings organized by the Ministry of Digitalization on how to use new technologies embrace only a small part of the population of older persons. So the interesting question in this regard would be how public entities can use new technologies to be more proactive in regard of providing information for and consultations with older persons, both at their homes and in care facilities. So I mean, how we can equip public entities in adequate tools to do their job in this regard. So, and to collect and use relevant data after consultations productively with appropriate tools. On the other hand, my general point would be that social participation of older persons should be based on the concept of healthy aging, including good relationships with other members of their families, friends, neighbors, volunteers, social workers, and others. The digitalization should be used to facilitate it, but in line with the will and preferences of older persons themselves. The COVID pandemic showed us that the digital means of being connected with others can only work short term. In longer perspective, this can deepen the feeling of being isolated, abandoned, or even imprisoned. That was what we've heard from older persons in care facilities here in Poland. This sounds like a serious deprivation of their rights. So, I will echo other voices that it should be states and local governments' responsibility to focus on how to use new technologies to assure and facilitate the enjoyment of the rights of older persons. Also, those senior citizens who live offline. The digital world should serve to achieve this purpose and not the other way round. It also was mentioned yesterday that we need skilled civil servants and social workers who can make our society and local communities friendly for all ages. I suppose that global aging and digitalization have one feature in common, and this is constant change. Therefore, I believe that civil servants should be trained not only on how to manage digitalization in aging societies, but also on soft skills like how to adjust themselves and social policy to constant changes, and how to support members of society in this process of constant change. This might also be a challenge in regard to our bureaucracy. One of the tasks of an HRI is to monitor public policies and to monitor how the rights of older persons are framed within them. There are more documents in Poland regarding aging and digitalization in different aspects connected also to the rights of persons with disabilities, which is good. We are only concerned about their successful implementation, which is questioned. But most interesting for me is how the participation of other persons is framed in the main, more strategic document, which is the Social Policy Toward Older Persons till 2030, Safety, Participation, Solidarity, adopted by the government in 2018, which is 2 years ago. As you can hear, participation constitutes one of 3 pillars of the strategic document on aging in Poland, and I need to stress that we really appreciate each line in the document dedicated to the right to participation. The main goals of the policy refer to digital accessibility of public entities and also to implementing new technologies facilitating access to healthcare services. Nevertheless, one should note some signs of superficial acknowledgement of the rights of older persons in this strategic paper. So let's have a closer look at the document. I will mention only 3 areas for improvement which matter most. First, was the lack of assigning additional financial resources needed to implement the goals. Yes, there are governmental programs supporting some aspects of the policy financially, but there are still local self-governments not interested or with no capabilities to acquire the resources. That means that other persons who live there, often in rural areas, have no access to many services or activities they need. The second is the lack of mechanism inbuilt in the policy that would provide effective evaluation focused on the quality of improvement. This could be a separate topic for a presentation. I will leave it for now, but one can imagine consequences. The third is the language of the document. There are still some paternalistic phrases like referring to low number of older persons taking part in cultural life because of their mental barriers, lack of understanding of contemporary art, and so on. We would name it stereotypes. So, moreover, all older persons themselves are not indicated among subjects of the policy. Yes, there is such a list at the page 12 of the document that includes families, local governments, state agendas, NGOs, but not older persons themselves. It gives an impression that older persons are not partners for the state in creating and implementing the policy, that the policymakers are talking about older persons and not with them. When we talk about the right to participation of older persons in times of digitalization, we need also to stress the right to education, which is combined with it. Currently, the state's activity regarding education of older persons is still presented in Polish SDGs reports as the part of the right of the goal first, which refers to reduction of poverty. There is nothing about education of older persons under the goal 4, which refers to quality education for all. This gives an impression that the right to education is still perceived as a social right for older persons and not as a human right. Still, the number of older persons taking part in educational activities offered is extremely low, about 5%. We cannot talk about state systemic approach towards it. These examples of public policy show us that for the last 7 to 8 years, our consecutive governments have been working on these issues, but we need a stronger commitment to introduce the necessary steps for further improvements. To conclude, we need to talk more about participation of older persons in times of digitalization, as there are many different aspects of it. We need trainings for public servants and for older persons. We need new social transfers which would enable each local government to take appropriate actions addressing the needs of aging society. The participation in social life thanks to new technologies or in creating new technologies is closely combined with the approach towards older persons and their participation in social life in general. We observe that the rights of older persons, like right to participation, to education, to healthcare, and even to dignity and to life, are combined with each other. They cannot be considered in a fragmented way. Therefore, we need a new convention on the rights of older persons, which would combine all these rights and aspects and give us a comprehensive approach. In this regard, there's a huge role of EU and governments of member states. We need something on the scale of the European Year 2012 of active aging and intergenerational solidarity. That year gave us in Poland such an important impulse to develop the first draft of policy on aging and actually to start our journey towards being a more age-friendly society. We need more regional discussion in Europe on effective implementation of the human rights-based approach towards older persons. So I'm grateful for the European Council's conclusions, and I look forward for further actions of the European Union. European Union can not only develop regional standards, but should take leadership in this regard on the global level. I thank you for your attention. Thank you.
Vielen herzlichen Dank, Anna Chabiera, für Ihren Input. Und wenn Sie jetzt, meine Damen und Herren, schon Fragen haben, die Sie gerne Frau Chabiera stellen würden, dann würde ich sagen, warten Sie damit noch eine kleine Sekunde oder schreiben Sie sie jetzt schon in den Chat, denn gleich wird es noch Gelegenheit geben, zu diskutieren. Aber vorher würde ich gerne unsere zweite Rednerin, die gleich auch an der Diskussion teilhaben wird, dazu bitten, virtuell. Sie ist uns zugeschaltet aus Schweden. Es ist Birgitta Sacrédeus. Sie ist Mitglied des Europäischen Ausschusses der Regionen. Da ist sie schon und schaut als solche auf die Rolle der Kommunen und Regionen und schaut, wie die eigentlich ihre älteren Bürgerinnen und Bürger darin unterstützen können, mehr Teilhabe zu erreichen mit und durch Digitalisierung oder an der Digitalisierung und durch die Digitalisierung. Ich freue mich sehr, dass Sie da sind, Frau Sacrédeus, und sage herzlich willkommen auf unserer virtuellen Bühne. Sie gehört Ihnen.
Thank you. And I believe in multi-level governance. That's why I today start at the EU level, where I am a member of the Committee of Regions. And as you know, 20 out of 27 countries is the regional level who has responsibilities about the health sector, but also, of course, the local level has also a great importance how we deal with elderly people. So that's why in the Committee of Regions, we have done opinions on digital agenda and also on active and healthy aging. And I myself was the rapporteur for the active and healthy aging. And so that's the EU level who is very important in this work, but also national-wise, it's very important how the governments work. Well, in Sweden, as you know, it's a big country, long distances, so the building of broadbands has been very important, and we have worked, Sweden has worked quite well with the broadband, so many places you can have internet, and also there we have used the digital systems, and elderly people can go to the libraries and get some help if they need to learn more about the digital systems. And national-wise, we have built up a network called 1177. It's a national platform where you can get very good information about health. You can get, if you have, for example, if you are an old person and you feel that, well, where do I get the knowledge? Then you can go in 1177 and get some information about your heart failure in general, what's the symptoms, how do you treat them, and so on. And it's very much used. They have counted that from age 13 and up, it's covered by 70% of the population. So this is, I think it's a unique thing. And what you can do is also you can have your private information in this 1177. And what you do is that you use your iPhone that you have connected to the bank, the same number you dial in on this page, and then you can come in your personal platform there, and there you can look at your medical records. You can also ask for consultations. We have many consultations about online when it comes to mental health as well. That has been very successful. You can renew your prescriptions. You can see the lab results, and you can rebook or book the time with the doctor or nurses. So this national platform, I think, is really a great success. But since it is the regions that also is responsible for the healthcare in Sweden, also many regions, and like my region in Dalarna, we have done a special app where you can book time with your doctor and other health professionals, and you can look at some of your results as well. And what is important now when we have COVID, people can also go in this app and book a time where they can make the tests. That is very successfully worked in my region to have this. I think as a summary and conclusion that it's so important that we make the digital possibilities democratic, and also for elderly people, that you build up an easy system to reach the digital equipment, that it can ensure that you can get some information, and it should be secret. That's why you have your bank account combined with this, so you should feel safe. And of course, Sweden is a country that we have a big trust in our government. That's why we let them get this information, and you can only reach them by your special bank account. And it's very important that you also feel that you can take care of your health also. Not just the professionals should decide about your health, but you could work with yourself and the professional health team together. And it's very easily done when you make it digital. I hope in the future that more, and especially elderly people, could be helped to use more the digital tools. And so we have to look at good examples around Europe to find where do we work well together, so the elderly people also can use this fantastic tool that it is to be able to find information about health problems, and your personal health also can be discussed online and digital. Thank you.
Ganz herzlichen Dank, Birgitta Sacrédeus, für diese erste Einschätzung. Wir werden auch hinterher mal in der Diskussionsrunde darauf schauen, ob sich dieses Modell, was Sie uns gerade aus Schweden vorgestellt haben, auch auf andere Länder übertragen lässt, wo da vielleicht die Hürden liegen oder welche anderen Best-Practice-Beispiele es noch gibt. Jetzt schalten wir zunächst, bevor wir zur Diskussion kommen, noch zu unserem dritten Diskussionspartner. Da schalten wir weiter von Schweden nach Slowenien, denn unser nächster Gesprächsgast, da ist er schon, wie schön, leitet in Slowenien ein nationales Projekt, das das aktive Altern von Arbeitnehmerinnen und Arbeitnehmern zum Ziel hat. Wie genau sieht das aus? Welche Möglichkeiten bietet die Digitalisierung, die Erwerbstätigkeit älterer Menschen zu verbessern, und wo liegen vielleicht auch die Herausforderungen? All das wird er uns jetzt berichten. Ich freue mich sehr, dass er da ist. Herzlich willkommen, Andraž Banfi.
Thank you very much, and greetings from Slovenia. So yes, as already said, I'm going to present a project that we run on our fund, but it is probably important that I say that I want to share it with you as an example of good practice. A good practice, how also a public institution can help companies to deal with their older employees, to develop their knowledge, their competencies, and take care of them. So, as already said, the project has in focus older people that are employed and that we want still to keep on the labor market. But before I start, I must maybe say a few sentences about the demographical changes in Slovenia. What is quite unknown fact is actually that we Slovenians are the 7th oldest nation in the world, not in European Union, but in the world. So this poses quite a few challenges for us also on the very labor market. So I'm just going to go to the presentation that you will get a glimpse of what I'm talking about. It works like this. The project is called Comprehensive Support to Companies for Acting Aging of Employees, or shortly ASI. And in terms of demographical changes, there are quite a few challenges that we are dealing with. If I start with increased life expectancy, we are living longer and longer. The retirement age is still quite early in Slovenia compared to other countries in the European Union. We also face lower levels of education of older employees and lower levels of participation of older employees in lifelong learning. And on the other hand, we also can face a general decline in birth rates. So Project ASI is trying to answer some of those challenges. And to sum it up, the action period of the very project is from 2017 to 2022. So we are just in the second half now. The project is mostly funded by European Social Fund and partially also by Slovenian Ministry of Labor, Family, Social Affairs and Equal Opportunities. And the total budget, or the total sum of the project, is almost 30 million euros divided into cohesive regions. Now, I think it's the best to share with you some results that we already have, and you will also see how we help companies to develop digital competencies of their older employees. So what we did so far is we had two public tenders. Oh, sorry, maybe just one thing. The main purposes of the project shortly. I talked about the challenges, maybe the main purposes as well. First thing is to respond to demographical challenges in a way that promotes prolonging the work period and postponing retirement. That is the first thing. So we want to keep all the older employees as long as possible on the labor market. Then we want to strengthen the competencies of older employees and to break or overcome stereotypes about older employees. And of course, we want to also empower employers with skills in order to manage an aging workforce in their companies. So the results, what we did so far, probably the most important thing is we already had two public tenders. One has already finished, the second is still in progress, and we are just preparing the third one. We offer with these public tenders financial support for companies in order to first develop strategies for effective management of their older employees, and then also financial support for companies so they can send their older employees to different training programs, different workshops, educational programs, motivational programs, etc. So everything that helps them gain different digital or other competencies. So far, around 800 companies were involved, around 650 strategies were produced, and also around 10,000 older employees were included or participated in the activities so far. And may I add that a lot of older employees decide to go to different workshops or training programs for digital competencies. And we're talking here about the very basic programs like, let's say, basic Excel or basic Word or other Microsoft Office tools to very specific and complex digital programs. Then what we also did or do is we also have, one has just finished and the other one will just start, two public tenders for pilot projects. What we do here we also offer a smaller financial support to companies. They gather around in a partnership, they make a partnership, and they are trying to produce different solutions or different measures for their older employees, of course, in terms of their needs, what they need in their company. And 13 partnerships so far finished their activities, and a few of them also did quite a few solutions in terms of digital competencies. For example, one company started special mentorship where older employees were mentors to younger generation, and they taught them different skills, different knowledge, but in return, younger generation, younger employees share their digital knowledge, their IT knowledge or skills with their older mentors. Then what we also do, we have annual conference. So far, we organized 3 annual conferences with more than 1,000 participants. We also have a special older employee-friendly company award. So we give this award to companies that are an example of good practice, how to deal with older employees. And a lot of these companies take care of their employees also in terms of digital knowledge. What we also did is that we issued a catalog of measures for the effective management of older employees. So it's like a Bible when every company can find different solutions. It has more than 60 measures and more than 30 good practices from Slovenia or from abroad. And we also organize special tailor-made workshops, training workshops for HR professionals, HR managers, and so on. We try to teach them as much as possible about how to take care of older employees in their companies so they can take this knowledge in their companies. We also organized one special conference last year with focus on older employees and digitalization or digital skills. Now, what we also did last year, we started or launched a media campaign, and it just started again this year, a few weeks ago. We also want to overcome some stereotypes about older employees with this campaign. And also one of the videos we have also focuses on technology. So it's trying to overcome a stereotype that older employees aren't familiar with technology. And we are trying to say that actually older employees have gone through many technologies and they mastered everything. So it's just a stereotype. So this is basically all about the project. And I would also like to thank our Ministry of Labor, Family, Social Affairs and Equal Opportunities for giving us the opportunity to present the project. And maybe it's also important to say that these are the key priorities of the ministry as well. So strengthening the role of participation of older people in the society and specifically on the labor market. And Slovenia will actually next year be on the presidency to the European Union. And these topics will also be one of the priorities of the ministry. So quality of work life for quality of life and quality services for quality aging. These are so the main topics. So this is it about the project. So I'm available now for any questions. Thank you.
Vielen Dank, Herr Banfi. Die Fragen, die werden auf jeden Fall kommen, gleich in der Diskussionsrunde. Vorher hätten wir aber noch wieder eine kleine Umfrage an Sie und ich muss Ihnen noch eine kurze Information weitergeben, wo ich mich sehr natürlich darüber freue. Wir haben insgesamt Zuschauer und Teilnehmer aus 60 verschiedenen Ländern, also wir können uns gut und gerne eine internationale Konferenz nennen. So, jetzt aber geht es weiter mit der Umfrage und zwar die Frage lautet, Covid-19 hatte zur Folge, dass wir unsere Interaktionen einschränken mussten und immer noch müssen. Konnten Sie digitale Alternativen finden, um mit Ihrem sozialen Umfeld während der Pandemie in Kontakt zu treten? Und da haben wir jetzt verschiedene Antwortmöglichkeiten. Ja, digitale Alternativen, die waren großartig für mich, konnte ich nutzen, hat alles super geklappt. Zweitens, ja, digitale Alternativen, die funktionieren, aber natürlich nicht ganz so gut wie der direkte Kontakt, wenn man sich wirklich gegenübersteht. Nein, als dritte Antwortmöglichkeit, digitale Alternativen haben bei mir überhaupt nicht funktioniert. Und viertens, ich weiß nicht, ich kann auf die Frage nicht antworten. Und jetzt schauen wir mal ganz kurz. Das ist nicht die richtige Frage, wie ich hier gerade sehe. So, gut, also sagen wir es mal so, die Frage stimmt, aber der Rest nicht so ganz, also bei der Umfrage unten. Deswegen schauen wir doch einfach mal, was sich da in der Diskussion dann gleich ergeben wird und wir werden daraufhin gleich später nochmal genauer eingehen. Aber ich gebe jetzt erstmal rüber, dass wir gleich in der Diskussion weitermachen werden und das wird behoben.
Herzlichen Dank, Martin. Und es ist natürlich sehr spannend, dass viele Leute abstimmen, obwohl die Antwortmöglichkeiten jetzt unmittelbar gar nicht zur Frage gehören. Also lass uns die Umfrage auf jeden Fall gleich nochmal wiederholen. Aber ich sehe, wir haben hier unsere 3 Schaltgäste für die aktuelle Diskussion anwesend. Das ist sehr schön, das freut mich außerordentlich. Frau Sacrédeus, ich glaube, Sie müssen den Anfang machen, denn wir werden hier mit Fragen zu Schweden bombardiert. Da wollen die Leute wissen, wie hieß diese Plattform nochmal? Haben überhaupt alle Schweden ein Mobiltelefon, was sie nutzen und in welchem Umfang werden diese regionalen Apps eigentlich tatsächlich von älteren Menschen genutzt. Also das ist auf ganz, ganz viel Interesse gestoßen. Vielleicht können Sie uns das nochmal beantworten. Also wie hieß die Plattform nochmal, um die es geht? Haben denn tatsächlich alle Schweden ein Smartphone und in welchem Umfang werden diese Services tatsächlich genutzt?
Okay, the platform's name is 1177, and you can reach it wherever you are in the world, actually, because this platform is digital. And on the question, do everyone has a smartphone?
Bei der Frage nach der Anzahl der Smartphone-Besitzerinnen und Besitzern unter den älteren Menschen in Schweden ist kurz die Leitung ausgestiegen. Das macht nichts, da kommen wir drauf zurück. Ich würde aber gerne ohnehin an die anderen beiden Diskussionsteilnehmer einen Aspekt noch als Frage weiterreichen, der auch in dem Vortrag von Frau Sacrédeus war, nämlich sie sagte, naja, wir Schweden haben halt ein großes Vertrauen zu unserer Regierung, deswegen teilen wir diese Daten. Da würde mich interessieren, wie ist Ihre Einschätzung? Wie essentiell ist eben ein solches Vertrauen, damit gerade ältere Menschen mit digitalen Instrumenten auch freiwillig und gerne umgehen? Wer möchte dazu was sagen? Frau Chabiera, haben Sie da Informationen zu?
I'm afraid I have not good news in this regard. Actually, in Poland, the trust for what our society has to institutions is quite low. So it needs an improvement for sure. And I think one of the things we can do is to collect data and to research and to make people involved in the processes, to make them more aware what's going on when creating the tools and how it works. Maybe that would be one of the solutions. So I think the trust comes with participation and with being involved and feeling that we have the impact on what's going on around us. So that will be my first comment on that. Thank you.
Sehen Sie denn da tatsächlich eine essentielle Bedingung dafür, dass digitale Teilhabe von Älteren überhaupt funktioniert? Wir haben heute auch schon oft das Thema angesprochen, Missbrauch von Daten. Die Menschen haben Angst, dass sie Opfer werden von kriminellen Machenschaften. Also wie wichtig ist es, wenn man zum Beispiel eine solche Plattform wie in Schweden installiert, dass die Leute wirklich dieses Vertrauen auch haben? Ist das eine Grundbedingung dafür, dass digitale Teilhabe überhaupt funktionieren kann?
I want to tell you, if you didn't hear it in my first intervention here, the platform is 1177.se. That's the platform. You can reach wherever you are, and then when you go in there, it looks like this. And then if you want to sign in, you can log in there. And then you use your bank ID. And yes, Swedish people trust this system because when you have this with your bank ID, then you come into your own page in this, and there you have all this information I told you about in my intervenience. You have your medical records, you can change your booking times, you can get some results from the lab test. So it's up to you as an individual if you trust the system or not, but most people do. I myself use this all the time because then I don't need to sit in a telephone queue or when I want to reschedule my bookings with the health system. So it's very convenient. You can use it 24 hours. You don't need to well, you can use it all the time. So, and if you want to have some information about the sickness you want to know more about, you can just go in here and you get information about it.
Und wie stark wird es tatsächlich genutzt in Schweden von den Älteren? Das war eben auch noch eine Teilfrage, die wir noch nicht besprochen haben.
I just know the numbers that from 13 years and up, it's 70% who uses it. So unfortunately, I don't have the numbers how many elderly who use it, but the ones who use it says that it's very convenient because sometimes you have ear problems and you don't hear. Then you can sit there and read yourself, and you can do it yourself. So sometimes it's more better for the quality, but sometimes, of course, you need to have personal contact. You don't do everything about this. You must, of course, have your personal contact. But slowly, I'm sure that more and more people will use it. And the elderly people who cannot do it, maybe sometimes they have for myself, my mother, I help her. So many of the relatives do help the elderly people. Or you can go to some professionals also at the health center if you want to have help from them. So it's very important to, of course, for elderly people to, if they are unsure, to get some help. But it's always you who decides how much of your integrity you want to give away. It's not obligatory or something. This is just an opportunity, another opportunity to reach healthcare and to be more preventive, because many sicknesses you can read about and find out yourself how you can treat it. So for prevention, this is fantastic.
Herr Banfi, Sie wollten auch gerade noch antworten, deswegen haben Sie natürlich jetzt die Möglichkeit. Bitte schön.
Thank you. Thank you very much. I just want to maybe get a little bit back. One of the questions you stated is also how to gain trust when we want our employees, let's say, because I'm talking in terms of our project, how to gain trust from our employees, especially older ones, to use, let's say, some applications, some other things. What I see in our projects and when we are dealing with the companies is still that maybe companies sometimes don't communicate enough with their workers. So I think it's crucial to share the information. We are going to include you in this and this activity. Is that okay with you? You are going to gain this and this knowledge and competencies, so you will feel better on your workplace and you will work easier, etc., etc. So this is, I think, important to share as much as possible the information, what we are doing, so that all the employees feel safe, not just when using an application, but also in general.
Eben kam gerade auch noch eine interessante Frage rein, die sich auf das, ich sage jetzt mal, normale Fernsehen bezieht. Warum nutzen wir eigentlich nicht das normale Fernsehen für Training und für Support, gerade in der digitalen Bildung? Und die Frage würde ich gerne an Sie einfach mal weiterreichen. Wäre das eine Möglichkeit, auch viele ältere Leute, ich sage jetzt mal, auf dem eher traditionellen Weg zu erreichen?
I think so, definitely. There was a series in the national TV, and it was a doctor for older people, and it was really appreciated. So of course, some countries like Sweden do still have some programs running by tax money, and this is a very important issue. We should have more of these types of programs where you can discuss about sicknesses, prevention. We know so much about prevention and elderly people, and that could be, of course, a very important channel to use TV, because we know that elderly people look more on TV, the traditional public-run programs.
Die Frage noch weitergereicht. Möchte noch jemand dazu gerne was sagen? Ja, bitteschön.
Maybe I would add something. I think this is, of course, a good idea, and every innovational approach towards education is welcome. But anyway, I think this is just a detail, and we need to look from more above to see whenever it is effective, the education, if you can measure it, if more people are thanks to the channel engaged, and so on and so on. So it is like really making a systematic approach towards participation and education. And this is why we need to really policymakers engaged in this process and committed to it. And I do believe that on the level of declaration, we can hear it, but still we need more actions and we need more commitment. So all channels are good, but I really would appreciate the more comprehensive approach towards it. Thank you.
Das ist ein Aspekt, der ja eben schon mal zur Sprache kam. Herr Banfi, Sie haben es ja so ein bisschen durchexerziert in Slowenien. Wie bekommt man denn die Leute dazu, dass sie sich für diese Dinge interessieren? Dass man also Teilnehmer, auch aktiv oder Arbeitnehmerinnen, Arbeitnehmer dazu motiviert, sich aktiv damit auseinanderzusetzen? Was sind da so Ihre Lessons learned? Welche Ansätze funktionieren, was funktioniert nicht?
Well, I can say that first thing is that we share as much knowledge as we can with the companies, the employers. They are the ones who then share the knowledge forwards in their companies. So what we're basically doing all the time from the very beginning of the project is, we are trying to overcome the stereotypes. We are trying to say, hey, you still have older employees that are here and that are capable of doing, and they have a lot of knowledge. So we want to break the stereotypes that, we need younger workforce. So that is the first thing. And when you change the mindset of the employers, which I think we did quite a lot from the beginning till now, we can see that every day. I think that then it is already a lot of already done. It's easier then, when companies have this in mind, they have a different approach to their workers, and they then start to work with older employees differently. So we are doing every day, also with presentations like this. We have media campaign, we have special trainings for HR professionals, so they gain this knowledge and take them in their companies and so on. So I think it works.
Ist das denn für ein Unternehmen ein finanzielles Investment, was sich am Ende des Tages lohnt, Ihrer Erfahrung nach? Also das heißt, wie viel müssen die Unternehmen da reinstecken, um zum Beispiel dieses zusätzliche Personal zu beschäftigen, um zusätzliche Kurse zu machen? Und was gewinnen sie auf der anderen Seite dafür? Ist das ein idealistischer Ansatz oder ist es auch ein ökonomischer, der sich lohnt für ein Unternehmen?
So it is obvious so far now that if you invest in your employees, it pays off. It returns to you in a good way. Employees are more efficient, they feel better, and in fact you also have less, let's say, sick leaves, etc., etc. And I think that it is important that companies change the mindset, because sometimes still the boards or the directors think in financial ways. They just see it's an investment, okay, that will cost us that much and it doesn't pay off. But in the end, it does pay off. We see it every day. And what we do on our project is that we help financially companies. I can say it's maybe important data. We give up to 3,000 euros to company so they can help themselves with some professionals and they can help them to prepare a strategy. And then, for example, in a second run, they get up to 1,800 euros per older employee, so they can go to different training programs, educational programs, workshops, etc. So this is quite a good sum, and they have around 1.5 years to use this financial support. So in this time and with this budget, you can already do something and make some changes with your older employees.
Herr Banfi, hier kam gerade noch direkt eine Nachfrage rein. Erstmal vielen Dank, dass Sie Ihre Erfahrungen teilen. Aber die Frage lautet, wo können wir Ihre Erfahrungsberichte, also die Teilergebnisse, nachlesen? Gibt es da irgendwie einen Link? Haben Sie da eine Adresse? Wo können wir das weitergeben?
No, it's not published like a publication. It's for example, we see it every day because also we have, because it's a European project funded by European Social Fund. We, of course, also measure, different things, how, let's say, which which educational programs were the most popular, such things. So it's not an entire publication with all the findings, but we have a lot of reports which gather around different data, for example. And when we are talking about that, I can already say to you, I mentioned just a minute before that public tender for competencies of older employees, around roughly 10% of all the educational programs were for digital competencies. So digital competencies are actually quite important, obviously, and as I said, around 10% of all the employees went to the educational programs for digital competencies. So if there are any data that anybody would like to know in details, they can of course write to me, and we'll prepare the information.
Herzlichen Dank, Herr Banfi. Ich glaube, dass also diese Nachfrage und auch die große Nachfrage nach den Beispielen, die Sie, Frau Sacrédeus, präsentiert haben, zeigt natürlich, dass das Bedürfnis nach positiven Beispielen ganz groß ist. Also dass ganz viele Leute ein Interesse daran haben, zu sagen, Mensch, vielleicht funktioniert es auch bei uns. Und das wäre noch so eine Frage, die ich an Sie alle drei hätte. Was glauben Sie denn, inwieweit lassen sich diese Erfahrungen, die Sie gemacht haben, mit diesen Best-Practice-Beispielen auch auf andere Staaten, Regionen übertragen? Ist das möglich und wo hakt es unter Umständen oder wie einfach geht es?
Well, if I should start, I want to tell you how important it is that we have a national platform for health and that we can also use regional. This is what we do. And of course, that means that you collect yourself and put public money into this, because this has nothing to do with private money or something. This is public money, taxpayers' money, and then you should get something out of it. And now, since we also should talk about the COVID-19, and there you have very good examples. How does it go to when you should lend your testing? Read more about it. You can chat here too, and it's also in other languages. It's not only in Swedish. So here you can also find it in other languages. So 1177.se. There you can find a national platform that is also you can use in the regional and for yourself. As I told you, you can read your own page there. So we are very happy to share this with you because prevention and health, I mean, health is wealth. If we have a healthy population and healthy elderly, then you cannot just look at them as burden. We have just heard that they can work for very long and they have a long experience. And many people that are old are not sick. So they can work, and the healthier they are, the more wealthy countries we get too. So this is a very important thing to share. So just go in there and learn. But of course, you have to collect yourself naturally for one platform.
Vielen herzlichen Dank für diese Einschätzung. Möchte Sie, Frau Chabiera, oder Sie, Herr Banfi, noch was ergänzen? Was würden Sie sagen, sind für Sie die wichtigsten Bedingungen, dass sich solche Erfolgsmodelle übertragen lassen? Also wie wichtig ist dann beispielsweise auch Netzwerken oder Ähnliches?
I would add here, I think that is a great role of European Union, that in terms of sharing knowledge on how to create good social policies on aging and how to implement them in practice. I do believe there is a huge space for improvement, but also to share what is already done and what we have developed, what we can from our Polish side share with other countries too. But that's what I thought about having such an event as similar as European Year of Active Aging and Intergenerational Solidarity 2012, like having a year of workshops, a year of discussion, a year of thinking together on how to be like effective in this regard of involving older persons in social life and to make accessible all the services and or trainings for older persons during the lifespan. So I do believe there's the really space for European Union in the actions. Thank you.
Vielen Dank, Frau Chabiera. Möchten Sie noch was ergänzen, Herr Banfi?
Yes, maybe just shortly, what we see or what I see from my point of view and from Slovenia, and if we would like to share this with other countries, is probably that, at least for us, it's important to work on stereotypes, to overcome stereotypes. Our project is talking about people that are still employed, but older, you know. So we have to break the stereotypes about older employees. When we do that, then it's much easier because employers and general society will change the way of thinking, and if you do that, it's much easier, and they see older employees as necessary and still very important part of their working environment. So that's it, I guess.
Ganz, ganz herzlichen Dank für Ihre Zeit und für Ihre Beiträge heute auf unserer Konferenz, die ja schon so ein bisschen einen großen europäischen Rahmen spannt. Alleine hier auf der Wand haben wir Polen, Schweden und Slowenien vertreten. Schön, dass Sie bei uns waren heute. Nochmal herzlichen Dank für Ihre Beiträge und Ihre Diskussion. Und damit gebe ich zurück an Martin, der nochmal eine Umfrage hat, wo dann die Frage auch zu den Umfragemöglichkeiten passt.
Genau, also besser gesagt, ich hoffe es, dass es gleich hinter mir so passieren wird. Die Frage lautet: Was sollte die oberste politische Priorität sein, um unsere Menschenrechte im Alter zu schützen? Erstens, Bildung, Entwicklung von Fähigkeiten und Sensibilisierungskampagnen. Zweitens, die Überwachung von Menschenrechtsverletzungen, bessere Umsetzung der geltenden Gesetze, neue Rechtsinstrumente oder keine dieser Optionen, da wäre dann was anderes fällig. Jetzt bin ich gespannt. Ja, das passt schon mal sehr gut. Sehr gut auch, dass keine dieser Optionen noch gar nicht genannt wurde. Wir sind ja bei über 500 aktiven Teilnehmern. Das heißt, das ist schon mal gut zu sehen, dass eine der oberen auf jeden Fall zutrifft. Und da haben wir eine ganz klare Tendenz zur Entwicklung und zur Bildung von Fähigkeiten und Sensibilisierungskampagnen. Genau, jetzt passiert unten natürlich immer noch einiges, aber mit dieser Tendenz, dass wir sagen, über 50% sagen Fähigkeitenentwicklung und die Kampagnen sind wichtig, damit gebe ich rüber zu Katja.